As Jessie mentioned, I'm a neuropsychologist at UCSF in the Memory and Aging Center and have a long-standing interest in trying to understand the cognitive and psychiatric symptoms that are so common in Parkinson's disease. So historically, doctors thought of Parkinson's disease as purely a motor disorder, but there's increasing recognition that cognitive and psychiatric symptoms are very common. Many patients with Parkinson's disease have mild cognitive difficulties, and some individuals with Parkinson's disease have more severe cognitive problems. Sometimes they have what we call dementia, and I'll talk a little bit later about what that is. Depression and anxiety are also very common, but good coping strategies can improve function and quality of life, and that'll be the primary thing that I talk about today. But first, let me begin by telling you about a couple of patients I've worked with that I think show you how heterogeneous Parkinson's disease can be. So Mr. M is a 70-year-old man with a 3-year history of Parkinson's disease. He's still working part-time as a lawyer. He has good decision-making. He has no report of memory loss and no complaints from his coworkers or clients about his performance. But Mr. M feels that it takes him longer to do his work. Sometimes he has difficulty focusing his attention. Although Mr. M is still generally a good driver, his wife complains that he drives too close to other cars. And Mr. M has a decreased interest in activities that he used to enjoy, but denies a depressed mood. Now I'll tell you about another patient I've worked with who has a very different presentation in terms of his cognitive and psychiatric symptoms. So Mr. G is a 66-year-old man, also with a 3-year history of Parkinson's disease. He stopped working and driving a couple years ago because he was having difficulty with those functions. He also has trouble doing his finances and requires support. He frequently misplaces in items like his glasses or his keys, and has trouble with multitasking, trouble doing more than one thing at the same time. Mr. G has fluctuations in his ability to pay attention, frequently needs to take naps, and also reports hallucinations of people traveling through the walls. He has anxiety and was recently given the diagnosis of Parkinson's disease with dementia. So as you can see from these examples, Parkinson's disease can present very differently in different people, especially with regard to these cognitive and mood symptoms. So what causes the cognitive and psychiatric changes in Parkinson's disease? Well, Parkinson's disease affects cells in the brainstem, like Dr. Christine was telling you about, that normally produce important brain chemicals. So the brainstem is the part of the brain that connects the spinal cord to the rest of the brain. And all patients with Parkinson's disease have changes in the brainstem. So we see a decrease in a number of brain chemicals that are produced and distributed by the brainstem. Usually we talk about dopamine, and Dr. Christine showed you how dopamine is produced by the substantia nigra and projects to the striatum and regulates motor function. But we also see declines in some other chemicals, including acetylcholine, noradrenaline, and serotonin. So what do these chemicals do? Well, dopamine is important for our motor function, but also plays a role in our cognition. Acetylcholine is important for cognition and also regulating sleep. Noradrenaline and serotonin are important for our moods. So many patients who have decreases in noradrenaline and serotonin will experience depression. And there are medications, antidepressants out there that can help increase those levels, and in many patients can improve their mood. But I'm going to talk now about dopamine and acetylcholine in a little bit more detail. So dopamine is depleted in Parkinson's disease at the level of the midbrain, and so that's the top part of the brainstem. So that's where dopamine is produced and then distributed to the brain. There are a lot of projections from the midbrain to the caudate and the putamen, which comprise the striatum, and the dopamine that goes there and then regulates the functioning of circuits that connect the striatum to the rest of the brain. So the striatum is constantly in communication with other parts of the brain, and dopamine modulates the functioning of those circuits. It helps those loops communicate. So when you have a loss of dopamine, those circuits, those loops with the rest of the brain don't work as well. And that can cause both motor and cognitive symptoms. So let me explain that again just with a different image here that I think might be helpful. So this is an MRI scan, and you can see an outline of the caudate and the putamen. So normally there's projections coming from the midbrain of dopamine up to the striatum, and then that dopamine regulates the functioning of loops with the cortex. There are a lot of loops with the frontal lobes, the front part of your brain. And these loops are really important for executive functioning, processing speed, certain aspects of spatial function. And I think this is why we see some mild deficits in these areas in many patients with Parkinson's disease. Now I'm going to shift to talking about another brain chemical called acetylcholine. So acetylcholine is lost quite a bit in patients with Parkinson's disease. You can see in this study, this is the reduction of acetylcholine activity in Alzheimer's disease in black, Parkinson's patients without dementia in gray, and then Parkinson's patients with dementia in white. And you can see there's the greatest reduction in patients who have Parkinson's disease with dementia, but even Parkinson's patients without dementia show quite a bit of loss of this important brain chemical. And because of this loss, we see some changes in cognition, including difficulty focusing attention, also some psychiatric symptoms. Sometimes hallucinations might be caused in part by loss of this brain chemical, and also sleep disorders. There are cholinergic agents that maybe some of you have been taking or have tried that can improve some of these symptoms in Parkinson's disease. So we've talked about how the brainstem is affected in all patients with Parkinson's disease, which leads to a loss of important brain chemicals that are important for cognition and mood. Also, the entire cortex, the entire brain, is affected in patients who have Parkinson's disease with dementia. And we know this because we see cell loss called atrophy throughout the brain, and also clumps of alpha-synuclein protein called Lewy bodies. These Lewy bodies are limited mainly to the brainstem in patients who have Parkinson's disease without dementia, but we see them spreading throughout the cortex in patients who have dementia. So there are a number of substrates for the cognitive and psychiatric symptoms. So I've used the term dementia quite a bit, and it's a term that I think many people don't understand, and it can be a scary term. So let me define it for you. All dementia means is cognitive impairment that's severe enough to interfere with daily functioning. It can be caused by a number of conditions. Usually dementia, most commonly, is caused by Alzheimer's disease, about half the time. But also dementia can occur in Parkinson's disease. About 40% of Parkinson's patients have dementia. Although the majority of individuals with Parkinson's disease do not have dementia, many report memory or thinking problems. So let's try a memory test. Sometimes I think it's most helpful to try out a memory test before I explain how memory works. So I'm going to read a list of words to you. And I want you to listen closely, and when I'm through, I want you to repeat those words back to yourself in your mind in any order. See how many of them you can repeat back to yourself, okay? So I'll read it a couple times. Apartment, blender, eggplant, spatula, firehouse, spinach, school, knife, green beans. Okay, let's try it again. I'm going to give you another chance to hear the words and then try to repeat them back in your mind. Apartment, blender, eggplant, spatula, firehouse, spinach, school, knife, green beans. Okay, so there are 3 parts to memory. The first part we call rehearsal, or sometimes we call it working memory or short-term memory. So this is the type of memory that you use when you have to remember some information for a very short period of time, like 5 seconds or 30 seconds. So if someone said, could you go dial this number in the phone for me over there, 4761237, you would hold that in your mind as you walk over to the phone to dial it using your rehearsal or working memory. Also, the first time I read that list of words to you, you were using your rehearsal or working memory to try to say them back in your mind. The second part of memory is called encoding or sometimes consolidation. And you use this when you want to remember something longer than 30 seconds. Maybe you want to remember something the next day or the next year. So when you want to do that, you have to encode the information into longer-term, more resilient stores. So when you encode information, you can hold a lot more information, and you can remember it much longer. The third part of memory is retrieval. So it's not enough just to get those memories into your mind. You have to also be able to pull them out when you need them. So I think we've all had that experience of trying to remember who was that actor who was in, Gone with the Wind, or, just trying to remember the name of somebody who you met, for example. So retrieval can often be a very challenging process for all of us. So those are the 3 parts of memory, and let me show you how they're based in the brain, and then we'll talk about how they're affected by Parkinson's disease. So rehearsal or working memory really relies heavily on frontal circuits. So the circuits or loops that involve the frontal lobes and also involve the striatum, the caudate and the putamen. Encoding relies critically on the hippocampus in the inside part of your temporal lobe. And the hippocampus is critical, but actually distributes the memory throughout your cortex. Retrieval relies on frontal circuits once again. So in Alzheimer's disease, the hippocampus is affected early in the disease, and that's why these patients have a lot of trouble with encoding. They might have trouble remembering what they had for breakfast that morning, where what movie they saw last week, for example, because the memory was never encoded into the longer-term, more resilient stores. So we see really severe memory problems in Alzheimer's disease. In Parkinson's disease, in contrast, first of all, typically the memory problems are not nearly as severe, but also they're very different. Parkinson's patients tend to have more trouble with rehearsal or working memory, and also trouble with retrieval. The good news is these are aspects of memory that can really be well supported by certain coping strategies. So what were the words on the list? Oh, good. I think you guys got them all. Very good. So no memory problems here. As a team, we could remember them all. So there's different strategies that you can use to help you with all those aspects of memory. And maybe some of you use some of those strategies. Take a moment and think about, how did you learn those words on that list? Okay, so let's talk a little bit about some of the strategies that can support memory in Parkinson's disease. To support rehearsal, that initial working memory for the words, you can use semantic elaboration. Well, what does that mean? It means making as much of a story or as many connections as possible to the information you're trying to remember. So with that list of words, you might have clustered them into categories, thought of them as a group of vegetables and a group of buildings and kitchen tools, for example. Let's say you just met someone new and you wanted to be sure that you remember their name. And she says, oh, my name is Alice. Well, you might then think of Alice in Wonderland. You might picture her standing next to a white rabbit or falling down a rabbit hole. So making these semantic connections to information you want to remember adds to the richness of the way the memory is stored in your brain and can help you remember the information later. Another tip is to make the information personally salient. So the more information you want to remember you can connect to something that's important to you, the more you will remember it. So as you're listening to these suggestions for memory strategies, the more you think about how these strategies might work for you or times when you've used these strategies, the more you're going to remember them. So make information you want to remember personally salient. Third, write it down. There is nothing wrong with writing down information you want to remember. And I see some of you taking notes, and I think that's great. I recommend carrying a little notebook around with you. And whenever there's something you really want to be sure to remember and you're not sure that you will, write it down in that notebook. Maybe at the end of the day, you can review what you wrote down, which gives you another chance to learn the information. The more we're exposed to information, the more likely we are to remember it. So I encourage you to come up with a good organizational system for writing down information you want to remember. How can you support your retrieval processes? Well, first of all, try to avoid noise or other distraction when you concentrate. Multitasking is often impacted a bit in Parkinson's disease, and so if you're trying to do more than one thing at the same time or trying to inhibit distracting information, it will be more difficult to retrieve the information you're trying to remember. Second, think of related information. So if you're trying to remember who was at the party you went to last week, you might think about where the party was, what you ate, what music was playing, or anything else you can remember. This will increase activation in the network where the memory is stored and help you remember whatever else you want to remember about the party. Another example of this that I bet all of you have used is if you misplace an item, where did I put my keys? We'll try to bring up memory of everything you were doing, what you were wearing, where you were when you last had your keys, and that might help you remember where you left them. So thinking of related information can help you retrieve a memory. And third, a great way to retrieve information is to refer back to wherever you wrote it down. So writing it down. Calendars can be very helpful. You can write in your appointments and events, and this can help you not miss them and also refer back to remind yourself what you did. Electronic reminders are useful to many people with Parkinson's disease. You can put in an alarm every time that you want to take a medication, for example. And I personally recommend you might consider trying other electronic devices like a smartphone. You know, these are really hard to set up at first, but once you get them set up, you wonder what you ever did without them. So maybe you have someone in your family or a friend who might be better able to set it up than you are. Ask for their help to help you get it set up if you don't feel comfortable yourself. Once you get into the habit of using it, it might really help you with your memory. And the last writing it down strategy I have is called the daily list. And this is more useful, I think, for patients who have a lot of memory problems and is really done by the caregiver, either alone or with the patient. So on the daily list, the caregiver or loved one might write down what is most important for his or her loved one to know that day. You can write it every morning or every time you leave your loved one home alone, and keep it in the same place so your loved one gets in the habit of knowing where to find it. So let me give you an example. So this is a daily list that a caregiver might have written this morning. Writing down the date, this can help keep your loved one oriented. I'm at the grocery store this morning until 10. Your breakfast is on the table. Please be dressed and ready to go at 11 because we're going to the conference on Parkinson's disease. And this evening, we will have dinner with our friends Janet and Michael. If your loved one is asking you the same question over and over again, having trouble learning a piece of information, you can write down the answer here. Like if your loved one keeps saying, "When are we going on that vacation?" You can write it down on the list, and this gives your loved one many chances, as many times as they want, to go and refer to the information. So I find that these daily lists can really help a patient stay more oriented to what's going on in his or her life and therefore function at a higher level. So my second set of daily memory strategies are to cultivate organization and routine. Keep objects in the same place. If you live with somebody else, maybe talk with them. Where do we want to always make sure we put our wallet, our eyeglasses, our keys, other items that we sometimes misplace? Have a spot for each of those, and then support each other in making sure you always put them in that place. If you see the eyeglasses out of place, pick them up and put them where they're supposed to go. If you get into the habit of doing this, then you're going to not lose your items as often. But we all do lose our items anyways, and so I recommend keeping your house as neat as possible so that it's easier to find them. For some cognitively impaired patients, doing daily tasks in the same way and at the same time each day can be helpful because it helps the patient get into the habit of following a routine. So again, this is for more cognitively impaired patients. As an example, I had a patient who was having trouble getting up in the morning, and the caregiver was really struggling with helping her loved one go through his morning routine. So what she started to do was to make everything happen the same way every morning. Every morning at the exact same time, she'd put on his favorite Frank Sinatra music and have his clothes in the same place and always go through the morning routine in the same exact way. So it just becomes a habit for him to follow the routine. The third family of strategies I have is to support visual spatial processing. So visual spatial difficulties are common in Parkinson's disease. There's been some research on driving in Parkinson's disease, and in patients who drive, they often can drive quite well. In fact, in some research, Parkinson's patients without dementia were able to drive just as well as people without Parkinson's disease, as long as there was daylight. So if they were driving in clear daylight conditions, no problem. But when the visibility decreased so it was foggy or dark, the Parkinson's patients made more errors. So that's just something to think about if you're driving. Maybe make an effort to drive when it's lighter out. And I think this is because if visual spatial processing is not working very well in the brain, you want to maximize as much inputs into the visual system as possible. So in other words, your brain needs all the input it can get. So the daylight helps with that. Relatedly, it might be helpful to make important possessions visually distinct. So having eyeglasses that have a colored frame or a big keychain that's also brightly colored. This can help you find the items more easily. And lastly, if you're having trouble finding your way around the house without bumping into things when it's dark, at nighttime, for example, a nightlight or reflector tape can help. So we've talked about memory strategies, and now I'm going to just briefly touch on some other strategies that can be useful for maximizing thinking skills and mood. So physical exercise, heart health, mental exercise, reducing stress, and medications. Can exercise modify Parkinson's symptoms? Well, motor impairments incline many patients with Parkinson's disease toward a sedentary lifestyle. But exercise can improve mobility, range of motion, and muscle tone. Also, exercise may improve thinking skills, improve mood, and may even slow down the disease, although that's controversial. Intensive exercise may be best. So while going for a gentle stroll is good for all of us, really getting your heart pumping and sustaining that might be even better. Safety issues must be considered, and so you might want to develop a program with a physical therapist, and also, of course, talking to your doctor. So I'll go over a couple studies on exercise. So exercise may boost your thinking skills. In this study, patients were randomly assigned to an exercise control group. The exercise group engaged in twice weekly 60-minute aerobic activity. It's a lot of time, right? Sometimes a big dose of exercise can really help. And in fact, the exercise group performed better on cognitive tests. And it may also boost your mood. So depressed patients who exercise show a reduction in depression, and exercise can also reduce anxiety. It's really an open question about whether exercise actually protects the brain in Parkinson's disease, slowing the disease. Mouse models of Parkinson's disease, though, show some evidence that it might. So exercise slows onset of symptoms in mouse models of Parkinson's disease, promotes cell survival, and stimulates dopamine synthesis. So exercise may be neuroprotective in Parkinson's disease, but more research is needed. And I think we're going to hear a little bit more about exercise in Parkinson's disease this afternoon. Reducing vascular changes. So what's good for your heart is good for your brain. The heart supplies our brain with blood and oxygen, so having good heart health is going to make your brain more resilient to the effects of Parkinson's disease. So manage hypertension, diabetes, cholesterol, eat a heart-healthy diet, manage stress, and exercise. Mental exercise has also been shown to be important for brain health. So several studies suggest that the degree of baseline mental activity is associated with reduced risk of developing dementia. But environmental enrichment can modify the rat brain at any age, which suggests that mental exercise throughout the lifespan may be important. Staying socially engaged is also associated with healthy aging. Many people ask me, is there a certain type of mental exercise that's best? Should I be doing crossword puzzles, Sudoku, or should I be buying one of those expensive computer programs to help me? And I think the real answers on that are still out. But at our group, what we tell our patients who ask this question is that really just do something that you love, something that makes you happy, challenge your brain, maybe find something you can do with other people so you can also be socially engaged at the same time. So if you don't like crossword puzzles, you don't have to do them. When we feel good, our brain works better. Our mind functions best when we are well-rested, relaxed, and have a positive attitude. Depression is common in Parkinson's disease, and it's related to the loss of those brain chemicals coming from the brainstem. But you don't have to feel depressed. See your doctor if you're feeling depressed. Therapy and/or medications may be helpful. Stay socially engaged, and also exercise. Lastly, I'll just close with a thought on medications. Medications are good and bad. They can improve cognition and mood, so cholinergic agents and antidepressants can be helpful for cognition and mood. Also, dopaminergic replacement therapy has been shown to help with some aspects of cognition. But some medications can have bad side effects in patients with Parkinson's disease. So certainly for everybody, but sometimes Parkinson's patients can be more vulnerable to side effects. So I just encourage you to be careful in introducing new medications one at a time and with low doses, watching for side effects. So when you start a new drug, try to notice, are there any changes that are detrimental? And of course, just work closely with your doctor on that. And carefully review your medication list, everything you're taking with your neurologist. So in conclusion, many patients with Parkinson's disease experience cognitive and emotional difficulties. Most patients with Parkinson's disease can still live active and full lives. To maximize thinking skills and mood, work on your memory strategies, try to engage in physical exercise, support your heart health, engage in mental exercise, try to reduce your stress, and also take a close look at the medications that you're taking with your doctor. I have a couple of opportunities that are available at UCSF in our group that I want to tell you about briefly before I close. So we have a research study on the heterogeneity of Parkinson's disease that's funded by the Michael J. Fox Foundation and the National Institute of Health. The purpose of this study is to understand why some patients have milder symptoms, less cognitive impairment, and different responses to treatment. Participation involves MRI scan and cognitive and motor testing. We plan to start seeing subjects in February, but we're interested in screening sooner. So to participate, you must have no other neurological problems, no pacemaker, and no dementia. If you're interested, you can contact our research coordinator, Erica Johnson, who's actually working the filming today over there in the corner. She's waving right now. We have some flyers outside as well. These are some of our collaborators who you'd meet if you come in to participate. We have 3 neurologists working with us. You can see on the left. Also Norbert Schoof, who's a world leader in studying MRI in Parkinson's disease. And there's our research coordinator. And also I'll be closely working with you as well. And the last opportunity to tell you about, we have this really neat program in the Memory and Aging Center where we invite an artist to spend time with us to learn about neurodegeneration and let that inform her art, and then she also inspires us as well. So we have a world-famous bluegrass fiddler with us right now, sharing ideas with us and putting on monthly workshops. If you'd like to come to one of these workshops, please see the flyers that are out there, or just go to our website, memory.ucsf.edu, and come share some creativity with us. Thank you.